So my name is Larry Akoko. I work for Muhimbili University of Health and Allied Sciences and Muhimbili National Hospital. I trained with the Merck Foundation at Tata Memorial Hospital as a GI surgical oncologist, graduating in the year 2020. During my training at Tata, I had realized that solid tumors requiring surgical oncology were contributing to almost over 8 of our top 10 causes of cancer, and there was no better surgical services offered locally to complement the medical and radiation services that were available. So I pursued a career in GI surgical oncology, majoring in stomach, hepatobiliary, pancreatic, and colon surgery. And since I came back, I've been able to do most of these major surgeries that before were not possible at our institution. So the Merck Tata Memorial Hospital Fellowship that I received is fully recognized by the Medical Council of Tanganyika as a subspecialty. So as such, I was immediately recognized and honored as a surgical specialist. And through that, I've also been able to publish, to develop my publication interest in cancer. And that has enabled me to get my promotion in my employment. And now I am an associate professor just after graduating from Merck Foundation. Since I came back, I've been able to organize local trainings on one of the most common cancers. And we have conducted 3 symposiums on colorectal cancer surgical management aspects, where we brought together a multidisciplinary approach of medical oncologists to the pathologists and to the radiologists. And this year we are planning an even bigger conference covering the whole of the GI surgical oncology to be hosted in Arusha sometimes later in September. So as a surgical oncologist and being the first one in the country, I think I've been able to influence a lot of other young surgeons who would want to get the same training that I got so that they improve their patient care. But there were patients that before were being condemned as inoperable. During my practice, I've been able to offer curative surgery to these patients and as well train my colleagues, especially the residents, since I'm in a university. So I impart some of these skills to my residents. My future goals is to start a local training in surgical oncology, and I hope Merck Foundation will partner with me to train both local and African fellows in surgical oncology. So we have addressed the protocols aspect, and I was very much involved in developing the cancer treatment protocols in the country that have been approved and adopted by the Ministry of Health as our standard treatment guidelines. And we are reviewing them this year, and we hope we'll improve them much further to benefit even patients that I cannot reach directly as a surgeon, but I can reach them through protocols development. So the Merck Foundation Surgical Oncology Fellowship Program is a very nice program. Especially, I went to one hospital, I was at Tata Memorial Hospital, and I can tell prospective students that the Tata Memorial through Merck Foundation is a high volume facility, and no one will regret pursuing their surgical oncology career through that scholarship. So they should endeavor, every surgeon who wishes to pursue oncology should be dying to get a Merck Foundation scholarship to go and do surgical oncology. My perspective in surgery and oncology had completely changed through that experience. So I would call upon Merck Foundation to increase its sponsorship to Tanzanian students. And when it comes to surgical oncology, I can be a focal point for referral of prospective candidates. And there are many who would like to go.